Now moving on to our viral cases of gastroenteritis, we have rotavirus. This used to be very common in children, but now we have a vaccine, or actually two vaccines, the Rotavirus vaccine and the Rotatec vaccine. This has saved numerous children from, being hospitalized. This used to really run rampant in daycare centers. Very contagious. Leads to watery diarrhea and vomiting for about a week. And fortunately now with the vaccine, we don't see this nearly as much. So you can kind of see here's when the vaccine was introduced and our cases really have dropped off dramatically. Norovirus, or the cruise ship bug. This is another viral infection. Can stay in the stool for 2 weeks or more, which means potentially someone can be contagious for 2 weeks. Many bouts of diarrhea and vomiting each day. Self-limiting, you see there, in 12 to 60 hours. Very contagious. That's why this is called the cruise ship bug. It goes around schools, goes around cruise ships, retirement homes, through the fecal-oral route of contamination. Fortunately, it's self-limiting, doesn't typically cause any complications, but very important to wash your hands, avoiding norovirus. Most cases occur from restaurants. They're hard to track. A lot of times people don't go to the doctor, so they're hard to track, but for some reason it got its nickname, the cruise ship bug, just due to the outbreaks that have occurred on cruise ships. There are several different hepatitis viruses, and they are so named because they cause liver disease. Hepatitis A, fortunately, we have a vaccine for this one now. This one is transmitted via the fecal-oral route. You'll have someone who has a hepatitis A infection. They defecate, they don't wash their hands, and then they prepare food. Someone ingests that food, and now they have contracted the virus. Fever, fatigue, loss of appetite, dark colored urine, jaundice, and this can last for a long time. There's really not much that can be done for treatment. If a person is unvaccinated, they can receive the vaccine, and that may help prevent them from developing the disease, but for the most part, treatment with Hep A is supportive therapy. Now, we had been staying fairly low in cases. In 2018, we saw a spike. Not really sure what happened to cause that spike. I couldn't really find any literature that talked about why we suspected there was a spike that year. You see that people that are most affected are the 30 to 39-year-old age group. Hepatitis B is not like hepatitis A. Hepatitis A is foodborne. Hepatitis B is bloodborne or bodily fluid-borne. So this one is spread through IV drug use, sharing needles, or through unprotected sexual intercourse. Hepatitis B can become chronic, unlike hepatitis A. Hepatitis A doesn't typically cause any long-term chronic liver damage. Hepatitis B can. Again, fortunately, there is a vaccine for this one now that we know provides protection for at least 15 years, potentially longer. And this is another one where there really isn't any treatment that can help. It is really just supportive treatment. Interferon can be given, which are basically fake antibodies. And it can lead to liver cancer if it's not detected and treated. This one stays pretty steady. A lot more cases of Hep B than Hep A. And again, if we look at kind of the ages that are affected, it is that 30 to 39-year-old group, although we are seeing a decline in those cases, with an uptick in the 40 to 49-year-old age group and the 60-plus age group. And part of this is that the virus can essentially be dormant, and someone may not realize that they're infected until they are in their 50s or 60s. Hepatitis C, similar to hepatitis B in the way that it's transmitted, but it doesn't often show symptoms, and it's treated similarly to hepatitis B. This is another one where people may not know that they're affected. You see the disease often lasts for 20 years or more with few, if any, symptoms. Seeing an uptick in this one, and again, this could be because more people are now being diagnosed. It's remained chronic for a long time, and now more people are being diagnosed. The issue with this one, though, is we're really starting to see an increase in younger individuals with hepatitis C. Hepatitis D requires hepatitis B. It's called Delta virus or Delta agent, and it requires a co-infection with hepatitis B. So if you receive the vaccine for hepatitis B, then you're protected against both hepatitis B and hepatitis D. Hep E, similar to Hep A in that it's transmitted via the fecal-oral route. Very rare in the United States. We don't hardly ever see this. And it's typically self-limiting. It's a very mild infection, except for pregnant women. It can be fatal and is often fatal in pregnant women who become infected. Now getting into our protozoan causes of gastroenteritis, we have Giardia, Lamblia, and typically these are spread, or this is spread through contaminated water. Typically what happens is someone's out hiking, they see this clear mountain stream, they're like, oh, I'm going to get a drink of this, not knowing that it's contaminated with animal feces that has Giardia cysts in it. Giardia will attach to the lining of the intestines and start to replicate. It can go away on its own, but it may take 6 weeks. Not susceptible to chlorine, so chlorination doesn't kill it. Boiling does, so you could boil the water and that would get rid of it. You see there, it's the most frequently diagnosed intestinal parasitic disease in the United States. So this one is the most common. Here's an image. I think this is a pretty neat image. So here's the intestinal wall, and here's your little Giardias that have attached to the cells on the intestinal wall. Has declined some over the years, and we don't see this extremely often, and mostly in the upper Midwest is where we're going to have the most cases. Another protozoan infection is caused by Cryptosporidium parvum, and generally self-limiting, but may take a month. Can be treated. Typically when we see this one, we see it occurring in outbreaks. You don't typically have just 1 or 2 people getting sick. You'll have a lot of individuals that get sick. Amoebiasis caused by Entamoeba histolytica, drinking water, and typically people who are otherwise healthy may not have any symptoms, but those who are young or old or immunocompromised may develop what we refer to as dysentery, which is a severe form of diarrheal disease. Good sanitation helps to prevent Entamoeba histolytica infections. Cyclospora, uncommon in the United States, although we do see some cases in the southern United States. And again, good sanitation will help prevent this one. All right, now getting into our parasitic worms. we have our first one, Ascoriasis, the roundworm, Ascaris lumbricoides. An individual will ingest the eggs through contaminated food or drink. The eggs go down into the intestines where they hatch. The larva will then penetrate the wall of the intestines to get into the bloodstream. They'll travel through the blood where they get to the lungs. They cause irritation in the lungs, and then the individual coughs them up, and then they go back to the small intestine where they will mature into adults and then start to mate. So the first types of symptoms that develop are referred to as Leffler's syndrome, which is cough, bloody sputum, difficulty breathing. This is when the worms are in the lungs and they're being coughed up. Fortunately for roundworms, very easily to treat. The biggest problem that we worry about with Ascoriasis is intestinal blockage. The worms themselves aren't very large, but there tends to be what we refer to as a bolus of them, so a huge group of them, and this group can grow so large that it actually causes an intestinal obstruction, and then they may have to be surgically removed. Hookworms are the most common parasitic worm infections that we see in the United States for the most part. And what happens typically with hookworms is the larvae are going to penetrate the skin. A lot more common in kids. They're running around barefoot. The worms basically bite and penetrate the skin in the feet. They get in the bloodstream, carry to the lungs where they're coughed up, and then go back to the intestines. So in that respect, similar to the roundworms. And this can lead to anemia, fatigue. The severity of the signs and symptoms that are seen are directly related to what we call the burden. So basically how many worms are living in the intestine. So these are called hookworms because they basically hook on. So here you can see the mouth parts of a hookworm where it has latched on to the intestinal wall. This is called cutaneous larva migrans. This is a rash that can result as the larvae start to move through the skin. An individual with hookworm may or may not have that type of rash. Strongyloides, very, very similar to hookworm infection. They penetrate the skin, make their way up to the lungs. Pinworm, another very, very common, and I would say hookworm and pinworm are right up there. I said hookworm is the most common, and pinworm is right up there with it. Again, in kids, don't typically see pinworms in adults, although it can happen. Signs and symptoms really begin with anal itching, because what happens is the female worms migrate to the opening of the anus at night and lay eggs. So this causes an irritation. The child scratches, and this can be linked to auto-infection or self-infection, where the child is scratching because of the irritation caused by the eggs. And then, children, not the most hygienic, and they scratch, then they put their hands in their mouth, and so they continue to reinfect themselves. So the diagnosis with this one can be done, microscopically, or can be done by what's called the Scotch tape test. Basically, this involves the parent putting a piece of Scotch tape on the child's anus in the morning time and looking at that underneath a microscope, or taking it to the doctor where they can look at it under a microscope and see if they detect any eggs that are there. And then this can easily be treated with any type of antihelminthic medication. Trichinelosis is caused by a whipworm. Can lead to diarrhea that can end up leading to a rectal prolapse, which is basically where there's been so much diarrhea that the rectum becomes kind of unattached from the abdominal wall and prolapses out through the anus. Trichinosis or trichinelosis caused by Trichinella spiralis. This one comes from pork. This one is referred to the pork worm. Typically, we don't see this much in the United States because we have a pretty good food supply that's, you know, checked and inspected, and because we cook pork. So don't eat raw pork here. And then the one that we commonly associate when we talk about worms, we think about tapeworm. So we have the beef tapeworm and the pork tapeworm. For most people, especially in the United States, they're not going to acquire these tapeworms. You can eat undercooked beef and still be fine, but again, undercooked pork. And we looked at the mouth parts of the worm before, where they have that scolex with those hooks that allow them to attach to the intestinal wall. The thing you have to worry about with tapeworms is that they can grow extremely long. They can be 6, 8, 10 feet long. So that is the end of our chapter on the digestive system. I know I went through that fairly quickly, so just make sure you review that before you take your test.